Hi, I'm Judy Chan. Today I want to talk with you about competition in healthcare. Most people don't think about competition in healthcare because healthcare is about saving lives and making sick people well again. But I'm talking about competition in healthcare at the consumer level. Patients aren't just patients anymore, they're consumers. Why is that, you say? Well, one big reason is that healthcare is a $3 trillion industry. Everybody wants to get into healthcare. Businesses that have never been in healthcare before are getting into healthcare. Just recently, Warren Buffett's company joined up with Amazon and JP Morgan Chase to form a different entity whose sole purpose is to reduce the cost of healthcare for their collective 1 million employees. Another example of companies that are outside of healthcare are the devices that you have, the Fitbits, the watches, all these things that monitor what you eat, the activity that you do in a day, your heartbeat, your exercise. Those are all companies that have never been in healthcare before. Another reason why we have consumers is because people are more engaged in their healthcare today. They want to know everything about staying well, staying healthy for as long as they can and as much as they can for the rest of their lives. If they get sick, they want to know where to go for care, they want to get high quality care, they want to know what treatments are available, and they want to know what alternative treatments are available. They are going to go into their primary care doctor armed with information. Another reason why we have consumers is because there are choices available today, especially for primary care and urgent care that weren't available just 5 years ago. The telehealth that we have today is not anything like the telehealth 5 years ago. And today we have retail clinics. In fact, I had the opportunity to experience a retail clinic. My daughter had all the symptoms of a urinary tract infection, which she told me at around 5 o'clock, being a teenager. I get on the phone and we're Kaiser members and talk to the advice nurse. And she says, yes, that sounds like what it is, but we don't have any urgent care appointments left today. She'll either have to wait till tomorrow or go to the emergency room. Well, going to the emergency room is not an option. I don't think that going into a room full of sick people and waiting 3 or 4 hours to see someone is appropriate care for this situation. So I get on the computer and I look for retail clinics that are nearby. We drive there. We see the nurse practitioner immediately. She tests my daughter to make sure that in fact she does have an infection. Then she writes a prescription, which we take 10 feet across the hall to the pharmacist, who fills the prescription, and we're on our way home. And that was great care. It was on demand, it was high quality, and it was extremely convenient. And on top of that, even though we had to pay for it, it saved us time and emotional distress. My daughter wasn't in pain for the rest of the night and complaining. She didn't have to take off of school the next day, and I didn't have to take off from work the next day to drive her to the doctor in the middle of the day. And the last thing about consumers is consumers expect great customer service. Their expectations are being set by industries outside of healthcare, but they bring that mentality to healthcare. So when they buy a computer, when they buy a TV, or when they buy clothes online, those same thought processes they're bringing to healthcare. And they're expecting that they get the same great service in healthcare that they got from Apple and Amazon. So now you know what competition at the consumer level is about in healthcare. The question is, how do you attract new patients and how do you keep the ones that you have? So the way to do that is to have great high quality care, convenience, choices for your consumer, and great customer service. Thanks.